Najam School of Medicine, and I'm very thankful to all the professors and teachers who are sitting in front of me, lovely teachers from the IECSM and other universities. I am very glad to meet you here, and today my topic is the EECP treatment. These are the contents of my presentation. First, I would like to tell you about the EECP eligibility advantages and conditions. But before telling you about the EECP treatment, I would like to tell you that, do you know the top 10 diseases account for the highest severity of the death? These includes the cardiovascular diseases, stroke, diabetes, and hypertensive heart diseases. According to the WHO statistics of the 2012, just because of the coronary artery diseases, 7.4 million people were died, and just because of the stroke, 1.5 million people were died, and just because of diabetes, 1.5 million people were died, and just because of the hypertensive heart diseases, 1.1 million people were died. And in our beloved homeland, Kyrgyzstan, more than 52% people are dying just because of the cardiovascular disorders. So the question arises in our mind that what is happening in the body of human being that lead toward the cardiovascular disorders. So the many people with these kind of diseases have the poor blood flow towards the heart and towards the body. So why the poor flow is being occurred? Because there is the plug formation into the arteries just because of fatty deposits into the arteries. Simple question, for example, if a rude professor is sitting here in front of a door looking like this and he's making a very thin place to go outside the class. So it will take the more time and it will take the least volume of the student to go outside. So what is happening there? There is a plug formation into the arteries that reduces the blood supply toward the different part of the body. So, and the second question arises in our mind that how we have to treat this condition. The current treatments such as the balloon angioplasty, they are basically invasive treatments. We need a cut, then enter into the human body and in contact with the person. So what we are doing into the balloon angioplasty, simply we are making an incision into the artery and enter the balloon into the artery, and this balloon will be inflamed at the area where the deposition is being occurred. So what we have to do here, these processes are basically invasive. It affects the patient's lifestyle and they have a very long recovery time. So that's why I am presenting you a treatment which is non-invasive, which is very trusted, FDA approved, known as the EECP therapy. Now come to the question that what is EECP therapy? It is basically the enhanced axonal counter pulsation therapy. It is basically the processes in which the axonal force is applied to the artery, to the area where the plug is being formed from anywhere of the artery. What will happen in this kind of a condition? Basically, a patient is lying down on a treatment table, and we have to fit the 3 cups. Number 1 in the clavicle area, number 2 in the thigh area, and number 3 into the hip area. What is the important purpose of these cups? Because when these cups are present, one condition, these cups basically inflate and deflate in each heart rhythm or in each heartbeat. What is happening? First of all, when heart is present at the rest condition, so the claves area cup is pumping blood and squeezing the blood towards the heart. This rapid squeezing is basically give the more oxygen supply, give the more nutrient supply, give the more volume of blood to the heart. So what will happen? The patient will not feel any kind of anginal pain. So the greater vascularity towards the heart is being occurred. Okay. And for example, if before the pumping of heart, these all cups are basically deflected. This rapid deflection is basically reducing the workload of the heart to supply the blood, to supply the oxygen, to supply the nutrients towards the different parts of your body. Because you know very well that oxygen is very important and nutrients are very important for every organ needed to be on the time. Okay, now the question arises in our mind that what is eligibility criteria for this treatment and how long this treatment is. The treatment is 1 hour per day and 6 days per week. Total will be the 36 hours session. Then a patient will not feel any kind of inguinal pain. Oh, what is the eligibility criteria? Basically, this is eligible a patient who has a long-term inguinal pain and during the physical activities or the stress. And if a patient is taking medications, but there is no relief, then he can use this kind of a treatment. And we have the eligibility for the invasive and the procedures. We know very well that in Kyrgyzstan, in Pakistan, in any area of the world, usually the younger, older people have a fear to go into the OT ward for doing a surgery like bypass. So everyone don't want to cut the breast bone inside of the heart, which is very invasive process. So if a patient have a fear towards a bypass surgery, towards any kind of angioplasty or steening, so he will go towards this kind of a treatment which is best for him. Okay, what is basically the advantages of this kind of a treatment? As I have already mentioned many of them, some of them I have mentioned here. Doing this kind of a therapy is basically promoting the angiogenesis process. What is angiogenesis? It promotes the blood vessels to be formation in your body. Number 2 is basically increasing the flow of oxygen toward the different part of the body. It will be the good for the activities of the different parts of the organs of the body. And third one is basically increasing the volume of blood pump the heart. Basically, it is affecting upon the cardiac output. And third one is basically, last one is basically the increase in the anti-inflammatory effects from this side. And if we talk about this side, as I have already mentioned these all kind of things, and before the presentation, that it is basically increasing the nitric oxide, which is basically important for the endothelial functions. And then we have the decreases the amount of workload, as I have defined, during the process of clotting blood from the clasp area towards the hip area. And third one is basically the increasing the coronary blood flow to the heart muscle, because heart is has a major role in our body. If the blood supply towards the heart is being good, what will happen? The heart will perform the function good. For example,